everyone. Let's just allow 2 to 3 more minutes for people to log in, and then before we officially start. Thank you. Okay, I guess we can start now. So good morning, good afternoon, good evening, everyone. I hope you are safe, well whenever you are in the world. To those who's new in the CGIAR network, welcome. We are absolutely delighted to have you on board with us. So CGIAR stands for Social Innovation in Health Initiative. We were launched in 2014, and we dream for a better and healthier world through social innovations. And we do this by research, capacity building, and advocacy. You'll get to know more about CGIAR in just a bit. And welcome also to those who are already part of the network, our various implementing partners, the university-based CGIAR hubs, and our contributing partners. Thanks for finding time to join us today. This meeting, as you can see, is recorded, and we are also live stream on YouTube. So for those, I encourage everyone to share the link to your friends, and maybe Jean will share the link of the YouTube live stream on chat as well. So I'm Art Ongkeko, co-leading the CGIAR Network Secretariat with Dr. Meredith Labarda, and I will be hosting and moderating this session. So we all know that health and innovation transcends traditional sectors and provide many opportunities for collaboration and intersectionality. And this is what precisely this CGIAR Talks is all about. So next slide, please, Jean. So CGIAR Talks aims to provide a platform for regular learning and partnership building opportunities in many fronts. So first, across country hubs, other implementing partners and contributing partners, and among potential and current members of the network, which we hope will eventually translate into collaborative activities and partnerships for social innovation in health. So in this inaugural CGIAR Talks, we are fortunate to have with us two esteemed speakers. The first speaker is Dr. Danielle Gilligan of the Consultative Group for International Agricultural Research, or CGIAR, and Dr. Milena Bautista Gomez from our very own CGIAR Latin America and Caribbean Hub. So for any topic-related questions, please reserve them at the end of the two sessions or two speakers, and we'll have a dedicated time for Q&A and discussion with our speakers. So if you have any questions, just feel free to chat use the virtual raise hand button if you have questions. And so to officially kick off the program, we would like to call on Dr. Maria Teresa Bejarano, an international development specialist with more than 20 years progressive experience in support to research for health programs at national and global levels. And presently, she is a senior research advisor at CIDA with the Department for Partnership and Innovation and adjunct professor of the Infection Biology Immunology at Karolinska Institute. Let's all welcome Dr. Maria Teresa Bejarano.
Thank you so much. And good morning, good afternoon, or evening, depending where you are. I hope we are in all parts of this planet, and I'm very happy about that. Thank you for this invitation to participate in the opening remarks to this new CGIAR Talk series, and particularly to this one. I feel pride and satisfaction in knowing that I had put a grain of sand connecting these two organizations, CGIAR and CGIAR, because both are supported by CIDA, and CIDA is convinced about the transformative capacity When SIDA initiated support to CGIAR about 5 to 6 years ago, the concept of social innovation was in many ways a new one, but SIDA was convinced about the transformative power of new social practices that meet social needs in a better or more innovative way than the existing solutions. And CGIAR has now proven the value of this support. When some months ago, I participated at a seminar of CGIAR, to which I was invited by my SIDA colleague who manages the support to CGIAR and who knows about my keen renewed interest in nutrition issues, I realized that there were so many commonalities and possibilities regarding social innovation, both in CGIAR and CGIAR. So I thought about connecting the dots, and more than funding, I think that many times our funders' objective can also be to find mutual interaction between organizations and connect them. And I think this is part of these synergistic effects. To start with, the transformative approach to solve problems that affect the most vulnerable populations, where women and children are overrepresented, is a common issue. Women taking up their rightful roles to co-develop and co-design solutions is essential to successfully transforming health and agri-food systems in a world facing rapid climate change and increased exclusion. Both initiatives have an understanding, CGIAR and CGIAR, have an understanding and approach the fact that the gender inequalities remain deeply entrenched, limiting the potential of women to be empowered and to build social, economic, and technological resilience to climate change and the health consequences that are attached to it. CGIAR and CGIAR aim to make possible that social innovations, organizational strategies, and government and private sector policies can effectively increase the voice and agency of women and neglected populations to improve their lives and to build resilience. CGIAR is a global partnership. You are going to hear much more about that. And Sweden has supported CGIAR since its inception during the early 70s and is regarded as the founding member. And CGIAR is by the moment being the largest support to research that SIDA provides. SIDA hopes that these series talks and the dialogue between CGIAR and CGIAR will facilitate and develop a long-standing relationship with partners that could allow for a co-design and testing of new interventions in a complementary and synergistic way, taking advantages of the experiences and know-how that both bring in. One example that I could see among many is the experience of CGIAR with social protection issues and its effects on domestic violence, and the CGIAR research experience and network at the grassroots level. Thanks again, and I wish the best for a long-standing and mutually reinforcing relationship between these two organizations. Over.
Thank you, Dr. Bejarano, for emphasizing the value of collaboration, partnerships, and co-creation to give us or to lead us through that transformative healthcare that we want to achieve for everyone everywhere. So to give us an overview of the SIHI network, I would like to call on our project lead and for the SIHI network and SIHI Philippines Hub, Dr. Meredith Labarda.
Thank you, Art, and it's a privilege to introduce the SIHI Global Network. So SIHI, as mentioned, stands for Social Innovation in Health Initiative, and we pronounce it as SIHI. So it's like upward, forward looking. So I think at the beginning, we want to mention that, especially for those who don't know SIHI yet, the SIHI network is supported by TDR, the Special Program for Research and Training in Tropical Diseases. And this is co-sponsored by UNDP, UNICEF, the World Bank, and WHO. And it's able to conduct its work thanks to the commitment and support from a variety of funders. And we would like to mention especially that TDR receives additional funding from SIDA, the Swedish International Development Cooperation Agency, and also support to SIHI. So thank you. So let me start by saying that I think all of us would agree that in the last century, the world has witnessed many great medical advances. However, our reality, especially in the health system and services offered to millions of people across the low and middle income countries, especially, they remain far from the actual needs and expectation. In other words, healthcare delivery gap still exists. And this is affirmed by World Health Organization and World Bank studies, among many other studies, that says half the world lacks access to essential health services. So the Social Innovation in Health Initiative, or the SIHI Global Network, we see this challenge as an opportunity to front-load community-engaged social innovations to bridge this healthcare delivery gap and transform health systems towards the achievements of sustainable development goals and, of course, the attainment of the universal health coverage. So I think the important question now is, what are social innovations in health? In SIHI, we define social innovations in health as inclusive solutions that meet the needs of end users through a multi-stakeholder community engaged process. So that's why we have activities such as this. So in SIHI, our dream, as Art mentioned earlier, is to have an increasing number of research institutions in low and middle income countries that play a leadership role in advancing community engaged social innovation and accelerate universal health coverage. So it's, I think, also important to mention that in SIHI, we have common values. I think this is what gives life to the network. We adopt a systems lens, especially in looking at social innovations, in working with communities. We are also driven by a common passion and vision. And of course, our leadership is inclusive. So we set the vision and invite contribution from all partners. So in other words, our approach, next slide, please. So our approach in the network is to engage countries through SIHI research hubs, as I'll be mentioning it later. And secondly, to create an enabling environment to support research in social innovation in health. So just a brief background of how the network started. In 2014, a collaborative undertaking emerged between the Special Program for Research and Training in Tropical Disease, or TDR, in the University of Cape Town, the University of Oxford, and the London School of Hygiene and Tropical Medicine. So the Social Innovation in Health Initiative, or SIHI, was developed on the premise that solutions to many health problems can emerge from communities, even in low resource setting. So the initiative is dedicated to advancing the understanding and application of social innovation in Global South to address these inequities in health. So far it has expanded in 2016 to include social innovation research hubs in China, Colombia, Malawi, Uganda, and the Philippines. And the country hubs provide a platform to convene the various health systems, actor, and promote and catalyze social innovations in health through research, capacity building, and advocacy. In 2020 to the present time, the network continues to expand and thrive. So at present, we have 13 hubs and other partners, and the SIHI Global Network of Partners is invested in advancing social innovation in health through research, capacity building, and advocacy. And you see, you will hear probably many of them also later, the hubs are represented in this platform today. So in your screen, we also see the different, as mentioned, 13 hubs already and counting. And I think the next question is, what is a SIHI hub and what do we do in the SIHI hub? So the SIHI hub is a research institution-based hub, and this is composed of, we partner with social innovators, we partner with the communities, we partner with government, with academia, with health implementers, and both the private sector and the government and other stakeholders. So we do research and capacity for research, storytelling, and raising awareness. We convene and build community, and of course, we're into institutionalization of these social innovations, integrating them into the bigger health system and other systems that are prevailing in the country. So just to mention briefly and just to show briefly some of the hub achievements in the past years from 2014 to 2021. So we have 421 social innovations that were identified. So far, we have 71 publications in international journals and counting. We have 52 research case studies. We conducted 21 calls to identify social innovations. We have 10 randomized controlled trials, 28 local and national events, and we have 42 case films. And if you're interested to look at this, you can check out the SIHI website, which will be, the link will be posted and shared also in the chat box in a while. So in closing, as mentioned, 13 SIHI hubs are present in 4 regions. We have 6 SIHI hubs from Africa. That's the hubs in Malawi, Uganda, Ghana, Nigeria, South Africa, and Rwanda. We have 4 hubs in Asia. That's in Philippines, China, Indonesia, and India. We have 2 hubs in Latin America and the Caribbean. That's in Honduras and Colombia. And the most recent hub that we have launched is our newest hub in Sweden. So through the network, we endeavor to embed social innovation in research in other countries as well. So in behalf of the SIHI Global Network, we would like to welcome you all to the SIHI Talks. And this is our last slide. So if you want to check out the SIHI website and other Facebook and Twitter platforms, it's posted on the screen. So thank you very much, and back to you, Art.
Thank you, Dr. Labarga. To our participants, I hope we have sparked your interest to be part of this growing network. So let us transform the world to social innovation. So we are now ready to hear our next first speaker. So Dr. Gilligan is the Deputy Division Director of the Poverty, Health, and Nutrition Division at the International Food Policy Research Institute. The focus of his research is on the economics of household investments in childhood nutrition and education in developing countries, as well as the impact and cost effectiveness of social protection in agricultural and nutrition interventions. Dr. Dan obtains his PhD in agricultural and resource economics from the University of Maryland. So let's all welcome to give us an overview of the work of CGIAR. AR is Dr. Danielle Gilligan. Dr. Danielle.
Thank you, Art. Can you hear me?
Yes, we can hear you.
Great. And I hope you can see my slides as well. Okay, people are nodding. Thank you very much. This is a wonderful opportunity. I'm grateful to Maria Teresa for connecting me and CGIAR to SIHI, and to Meredith and Art and all for hosting me. And I'm going to give an overview of CGIAR itself, which is a convening of now 11 research centers. I'll spend a bit of time talking about IFPRI, the International Food Policy Research Institute, where I'm based. And then I'll highlight some of our work on health in particular and on social innovations, hoping that can kind of spark more discussion, or you can see some commonalities in what we do and hopefully spark some discussion. So I'll start just with this map of the CGIAR research centers. So we have now 11 centers under the CGIAR. We at a maximum, we're at 15. As I'll describe in a minute, CGIAR is undergoing a reform. We're actually bringing the centers closer together to try to better achieve our shared objectives. And so in that process of coming together into what we call one CGIAR, we have these 11 centers that have joined. Together, we are the world's largest publicly funded agricultural research network. Our staff number nearly 10,000 staff across the 11 research centers. We do our work primarily through partnerships. So this type of opportunity is exactly what we hope to take advantage of. And we count now more than 3,500 research partnerships, and we are present in more than 100 countries. And the CGIAR centers together have been operating for more than 50 years across a variety of countries, and I'll get to that more in a minute. Just a little bit about sort of the background of this sort of 50 years of our history. In the 60s, the history really begins with detailed support of breeding programs in rice, wheat, and maize. Some of that work contributed to the Green Revolution. And then with the food crisis that occurred in the 70s, really kicked off the development of a number of CGIAR research centers, including IFPRI. And you'll see as our focus on other crops sort of began to expand there. And then you see this continued growth into the mid 70s, an expansion into the topical areas of genetic resources, dry areas, and West African rice breeding. And then food policy really kicks off and sort of becomes a major focus, which is what IFPRI's specialization is on food policy in the 80s and institutional strengthening. And from there, we've expanded into the 90s and beyond into a much more diverse and comprehensive research program. And you'll see now at the top, as we reach 2022, under the one CGIAR reform that I've mentioned, these are our 5 main impact areas, and all of our research is meant to address these 5 areas on climate adaptation and mitigation, poverty reduction, livelihoods and jobs, nutrition, health, and food security, where I think much of our opportunity to collaborate with you would exist, environmental health and biodiversity, and gender equality, youth, and social inclusion. Another, I think, important topical area where our goals with you really overlap. Okay, so with that, just to try to give a better focus of what the comparative advantage of the CGIAR is, that I think this research does fill a unique global niche. So first, we create new improved plant varieties. CGIAR operates 11 gene banks and is really a critical global leader in maintaining these gene banks to safeguard the world's largest and most diverse crop and forage germplasm. We create new tools and approaches to help farmers and farming and food systems. We are very much, as SIHI is, focused on a systems approach, now under one CGIAR on food, land, and water systems. And then another major focus is promoting gender equality and really leaning into the use of data for research. So we are, as I said, a primary research institution, and so we're heavily focused on developing research, and then convening and participating in initiatives that actually turn the results of this research into policy information, policy action. So I'll highlight a couple of areas of major impact of CGIAR. We can say that almost half of the world's wheat land is sown in varieties that came directly from CGIAR research that improve rice varieties. It's estimated to contribute to about almost 11 billion annually into sort of global economic benefits. Biofortified crops through Harvest Plus have been supported through the CGIAR through partnerships and development with breeding programs at the country level. Major success has been orange flush sweet potato, which is a dense source of vitamin A and is now grown in 16 African countries, reaching almost 30 million people. Also work in modern crop varieties has reduced infant mortality by 1/3. And SPIA, our impact assessment group, has estimated that our innovations have reached nearly 80% of all rural households in Ethiopia. Okay, I've mentioned the one CGIAR reform. That reform has been a process by which 11 of the CG research centers have come together and agreed on a shared program of research. As I said, that feeds into these 5 impact areas that you see on the left here. And we have 3 main science pillars under the new one CG reform. A major pillar there is called systems transformation. And within systems transformation, we have these 12 research initiatives. We also have individual projects, which we continue to work with our donor funders and governments and other partners on other projects. But through this reform process, we've identified major areas of research in which we work with donors to provide funding. And so there's these 12 initiatives under systems transformation. And those are, you can see the way in which they are all integrated. So they each inform the 5 impact areas, but they also have some focus. And I'll spend some time on just a few of these, particularly in these petals on nutrition, health, and food security, and gender equality, youth, and social inclusion. So one that I want to mention is called FRESH, the Fruit and Vegetables for Sustainable Healthy Diets. So here we focus on increasing fruit and vegetable intake as a way to improve diets and improve nutrition and health outcomes for women and youth in particular. Where this is, again, one of our newest research initiatives where we plan to work with existing partners and develop new partnerships The scope initially is to reach 10,000 farmers, of which 50% would be women. In the early years, this is really just months underway now, and working with other key actors on these objectives to improve and expand consumption of fruit and vegetables. SHIFT is the Sustainable Healthy Diets Through Food Systems Transformation Initiative. This is a large initiative led by Marie Ruel, who's the director of the Poverty, Health, and Nutrition Division at IFPRI. And so here the focus is on helping consumers make healthier, safer, and sustainable food choices. The focus here is really on improving diets and building policies and innovations to help deliver those diets with a focus as well on gender equity and social inclusion. And next, I'll mention HER+, harnessing equality for resilience in the agri-food system. So I'm the co-lead working with Nicolene DeHaan, who leads the CGIAR gender platform. I co-lead HER+ with Nicolene. We have a really diverse program of research on gender and promoting gender equality, and also other dimensions of social equality, working, for example, on gender transformative approaches, on strategies to use social protection to improve gender equality, and also on strengthening governance. Okay, with that, I'm going to pivot and just spend another couple of minutes on IFPRI before just giving some examples of what I see as CGIAR research that really, I think, links closely with SIHI's objectives. So IFPRI is the social science center within the CG. It's the main area where social science research takes place. This blue dot here in Washington, DC shows you where we are located. And we've also here pinpointed countries where we have country offices and also regional offices around the world. In fact, IFPRI has country offices, I think, in most of the countries where SIHI has hubs. For example, we're working in Ghana. We have country offices in Ghana, Nigeria, Malawi, Uganda, and Rwanda. And also in China, where I know you also have a hub. But we have, our research covers, of course, many more countries than this, but these country offices also have, we have country presence there and could support potential collaboration with you. Just briefly sort of showing our structure at IFPRI, where Johan Swinnen is the Director General. And in the left-hand column, you see our 4 research divisions: development, strategy and governance, environment and production technology, markets, trade and institutions, and poverty, health, and nutrition. And those, during the reform process, we may see some reorganization of these, but the main topics there will stay still represented in sort of revised units. So within those 4 main research pillars, here are the variety of topics over which we see how IFPRI makes a difference in investing in social protection, increasing access to nutrition, improving food security programs, and scaling up pro-poor investments. Those are all activities and research areas that are supported by the Poverty, Health, and Nutrition Division, where I sit. Okay, with that, I'm going to take my remaining time, just a few more minutes, to talk about a few examples of CG research. That this was all research that was, or including research that was supported by IFPRI. To give you some examples of areas of innovation and health that I think represent good possibilities or the type of opportunities that I think we could potentially collaborate on. I've mentioned the work on biofortified orange flesh sweet potato. That initiative was led by Harvest Plus. It was a major multi-year effort with substantial funding. Our team in the Poverty, Health, and Nutrition Division worked with Harvest Plus to do impact assessments designed as randomized controlled trials to show the effectiveness of introducing orange sweet potato in Uganda and Mozambique. There's published research to show that this is proven highly effective to tackle vitamin A deficiency in the first 1,000 days. That just 125 grams of orange sweet potato meet the daily vitamin A requirements in preschool age children, and the children actually really like it and are happy to eat it. And we now see that almost 7 million households in Africa and South Asia are growing and eating orange sweet potato. Some results from our research here show the impact of actually introducing orange sweet potato in Uganda on the prevalence of inadequate vitamin A intakes in children and women. And you see here that we had two different models in our RCT and a different intensity of introducing our sweet potato and a control group. And you see a big reduction going from baseline, the blue bars, to the follow-up survey rounds, the orange bars. You see a steep reduction in the prevalence of inadequate intakes of vitamin A in young children. So significant impacts there, about a 1/3 reduction in the prevalence of inadequate intake of vitamin A, and also a similar size reduction in low intake of vitamin A for women. Just getting my slides here. There we go. So biocontrol for aflatoxins is a major area of research that will continue in the 1CG reform. Aflatoxins can destroy crops, but also are harmful to humans. So AflaSafe is the technology that's meant to overcome this problem, and it's used on more than 360,000 hectares of land producing maize and groundnut, and is now being scaled up in the countries listed here. Another way in which crop-based interventions can actually improve health. So I have mentioned gender transformative approaches. HER+ has a focus on that. This is actually integrated throughout our research. You'll see that in nearly everything that the CGIAR is doing, and certainly IFPRI's work. And it's an important way in which we our health-based initiatives, particularly those in nutrition, are really focused also on the status of women and improving women's empowerment. I'll mention just one more example from very recent research. I haven't spoken too much yet about our work in social protection. We integrate often social protection programs with nutrition interventions as a way to improve health. Currently in Ethiopia, we are working with World Vision, CARE, and a local NGO called ORDA to develop or introduce a graduation program, a graduation model poverty program. It's highly multi-sectoral and does include interventions in nutrition as well. One component that's innovative there is that we introduced a group therapy model as a way to address depression in women. And the results there is that after just 12 weeks of group therapy, we actually showed that women who were screened for elevated depressive symptoms had a really large reduction in the prevalence of major depressive disorders. You see that across the sample, we had a 5.5 percentage point reduction in maybe among the extreme poor sample, an 8.8 percentage point reduction. This was on a control level of 7% and nearly 11%. So these are major. This is a highly effective and cost-effective intervention to reduce women's depression and attempt to address mental health. So I highlight this here just because I think it's quite innovative and just an example of the type of integrated programs that we're very interested to study. Okay, with that, I will end and hope we have some time for discussion. Thank you.
Thank you, Dr. Gilligan, for sharing the immense and inspiring work of CGIAR. One of the things that my key takeaway there is a clear pathway from innovation to impact, which is, I think, a crucial element for any decision makers and to drive investments towards a particular innovation in a long term. So our next speaker, so Dr. Gilligan, thank you very much. So for all those who have questions, kindly reserve them. We'll have that Q&A and discussion after our next speaker's session. So our next speaker in that regard is Dr. Milena Bautista Gomez. Dr. Milena is a sociologist and a social scientist and researcher of the SIHI Latin America and Caribbean Hub. And to give us an introduction to the comprehensive care model for rural health, in Sumapaz locality in Bogota, Colombia. Let us all welcome Dr. Milena Bautista Gomez.
Thank you very much, Art. And thank you for sharing my presentation. Okay. As Art has said, today I will talk comprehensive care model for rural health, Sumapaz locality, Bogota, Colombia. This innovation was identified in the SIHI call 2019. And I would like to share with you some data about the context and the main components of innovation. And next, I will present the video. Okay, next slide, please. Perfect. The innovation is it has high level of inequality between urban and rural areas, including the inequality in health. Specifically, the project has development in Sumapaz, a rural area within the Bogota city that is the capital from Colombia. The main challenge that motivated the creation of innovation was the access barriers in health for the rural population, but also for implementation of solution was necessary to take into account other important variables. For example, the violence, because historically Sumapaz has been affected by Colombia armed conflict, and also it has a limited health infrastructure. Next slide, please. Okay. The innovation was created in 2001 by Nazareth Hospital that today is named Subret Sur, and there is a public institution in Sumapaz district. Sorry, the last slide, please. I think. No, after the second one. Sorry. This one. Okay, perfect. The model was created by Nazareth Hospital in 2001. That is the public health institution in Sumapaz district. The model was created based on a health diagnostic of health needs using a complex collection data as a knowledge exchange process. And based on this process, the team created a creative solution according with the sociocultural feature of the farmer population and the rural context, all within the aim of ensuring to access to health for this population. Next, please. Perfect. The innovation is based in an holistic approach of health, understood as the state of complete physical, mental, spiritual, emotional, and social well-being, and not only as the absence of disease. In the following scheme, we can have an overview of the project and its main components. The first one is the community participation. For it, the main strategy has been the creation of 10 community networks. They are training process to form community leaders in health. The second one is the inclusive and holistic health through two main strategies. The first is the home visit to remote village to provide care to each family and identify health risk factors. And the other one strategy is the health routes, which are an accompaniment system to facilitate patient referral from Sumapaz to the city for the medical specialized attention. The third component is food safety and natural medicine. That is a very, very important component, innovative component in the process. And its most important strategy is the creation of public health park named Chaken Park, where are development environmental community education through workshops to promote the meaning learning using didactic tools and analogies for the rural life. This workshop promote the home gardens, the use of medicinal plants, the agrochemical control, as a good practice for adequate nutrition and health, among other topics. The implementation of these components and strategies along about 20 years result in an important achievement related to the improvement to health of population equality, coverage, and inclusion of health. Next, please. Okay. In summary, the model development a process of social appropriation of knowledge as a result of the exercise of co-creation between communities and the health institution, and the use of effective mechanisms to transfer of knowledge, having a main focus the environmental approach of health. As you can see in the slide, the model has been recognized several times by national and international institutions, especially in nutrition, environmental, social, and innovation fields. Okay, next we can present the video, please. And you can share the video in the link.
Sí, yo nací aquí en Sumapaz, mi madre también nació acá en esa localidad. Mis abuelos sí vienen de otras regiones por causa de la violencia. Llegaron acá a este páramo, al páramo de Sumapaz.
Bueno, nuestro modelo de atención en salud para la ruralidad nace precisamente de estas necesidades que tenía la población rural. Nosotros, para facilitar el acceso a los servicios, tenemos el programa de Ruta de la Salud. Entonces nosotros este usuario lo recogemos en su casa, lo traemos a nuestras instituciones a recibir la atención y nuevamente lo regresamos. Utilizo la Ruta de la Salud para ir a las actividades de la red de seguridad alimentaria y la red ambiental, y también para ir al hospital. Digamos, en mi caso, que estoy en estado de gestación, me brindan, pues digamos, lo que es consulta externa con el doctor, los cursos prenatales, urgencias, traslados hacia la ciudad.
Lo que hago es que laboro acá en Sumapaz con la subred sur y promuevo el uso de las plantas medicinales, y por otra parte también atendiendo pacientes que ya tienen algún tipo de situación, combinando esas dos herramientas, terapia neural, plantas medicinales. Pienso que es importante la medicina alternativa, o mejor llamada integrativa, porque integra lo que necesita el ser humano en un momento determinado.
Pues el parque se crea en el 2007 como una estrategia de educación en salud pública. La función principal de nosotros es que los campesinos que interactúan con el parque puedan diseñar en sus fincas sistemas ambientalmente sostenibles, recuperar un poquito esas prácticas que usaban los indígenas. Entonces el parque tiene un fuerte enfoque en agroecología, en producción sin químicos, en conservación de suelos, en diversidad, para que los campesinos pues sigan teniendo su vocación y mejoren su producción de alimentos, cuidando el ecosistema y sobre todo pues la salud de ellos.
El impacto positivo del modelo de ruralidad y del parque Chaquén, el principal impacto es cuando cuando una persona hace un clic y cambia ese chip y se da cuenta que la salud es responsabilidad de uno mismo.
Buscamos no solo que ellos puedan cultivar en su casa, sino que también busquen una alternativa para salir, digamos, adelante. Entonces una alternativa económica, que ellos puedan, entre ellos, puedan comercializar sus productos, poder trabajar con la comunidad es un factor muy importante. El poder identificar las necesidades y poderlas resolver, eso es un éxito.
¿Sí? Como hacer la analogía de que nosotros somos igual a una planta, si la tratan con cariño, con amor, si la cuidan, si la fertilizan, si la abonan, va a sacar buenas cosechas, se va a vender bien. Eso mismo le pasa a una persona. Si desde pequeña se le garantiza el acceso a la salud, pues esa persona también va a tener una calidad de vida y pues un desarrollo humano óptimo.
Sí han mejorado mi salud y la de mi familia. Ha sido un sitio de encuentro que de pronto no conocíamos y no aprovechamos en un principio, pero que ahora sí nos apropiamos como comunidad para nuestro beneficio, para de pronto un rato de esparcimiento, de pasarla bien, de compartir.
Thank you, Dr. Milena, for sharing with us the inspiring work of the SIHI LAC and for introducing us the Sumapaz model for others to replicate potentially in their own individual context. So at this juncture, the virtual floor is now open for questions if you have any. So you may want to use the virtual raise hand button if you have any question, and I will just introduce yourself, your organization, and you can now unmute. We will acknowledge you and you can unmute and ask your question. All right, Michael, you're acknowledged. You may now ask your question.
Thank you. Good afternoon, good evening, good morning. Thank you for the very insightful presentations. I think we can learn lots of things from these projects, from these activities, both from CGIAR, which seems to be a very vast spectrum of activities, and as well from specific projects like the one in Latin America that was presented, which seems to go across the boundaries of multi-sectoral work and fields. I have a question for Daniel and one for our colleague from Latin America. The first question is for Daniel, and it is about, you mentioned the country offices, the offices that you have in countries, and they partially overlap with the countries where SIHI has hubs. So I was wondering if you can just say in a few words, maybe a bit of the role of these offices that you have in countries, and any potential areas where activities could be complemented by the work that SIHI is doing in the respective countries. And the second question is for our second presenter, and I was interested to hear about what was the biggest challenge that you had in rolling out your project at country and community at the community level in that specific locality. Thank you.
All right,
yeah, let's go Dan first and then Dr.
Okay.
Marie. Yeah.
Yes, thank you.
Go ahead.
Thank you. Michael, thanks very much. I really appreciate your comments and thanks for the question too. Yeah, so just to be clear so I was referring there to the IFPRI country offices, and I'll just acknowledge that the other centers also have offices in a variety of countries, but I focused a bit on IFPRI in part because that's my home. It's also at the social science center of the CG where a lot of our work on health and nutrition is based. So, and we do have country offices that overlap in many of the countries where your hubs are located. So these offices play a critical role, and actually it's been a growing role for the last 10 years. They typically provide a connection to local policymakers. So usually there's a central project of the office that's a policy advising project. It's working with ministries of agriculture, planning ministries, or ministries of health to undertake research and research communication around key policy questions for that government. But they also then help. They can be a source of demand. In fact, this has happened with our offices in Malawi and Egypt, where partners have come and said, we're looking for greater support from IFPRI and from the CG on these topics. And through a variety of conversations, we end up then building out a research program, sometimes even doing joint fundraising to help cover the cost of the research. And those country offices also connect with IFPRI headquarters and the researchers that are based there. So it's a great sort of convening point. And they also have local capacity to support data collection and research working with local partners. Thanks.
Thank you, Dr. Dan. Dr. Milena?
Okay. About your question, I think that had exist different challenges in the community level. Maybe we can understand in 3 levels. The first one is the violence, because it's an area that has been affected by the armed Colombian conflict, and this suppose an important barrier to access to people and territory, for the innovators and the health practitioners. But the other is in the level of territory, because the rurality. The rural areas in Colombia are very complex because are very big, and it has a low level of infrastructure, so it's very difficult the coverage in health. But the other thing that is also very important is the cultural level, because the traditional farmers had very bad habits in food, in health, but bad practice that was very, very difficult to change. Was required a very long process to education, to practice, and was more difficult in the case of this community for the violence, because they feel a lot of mistruth about the all institutional organization, including the health. So was a very long process to achieve the truth of people. Yes. But finally, about next of 20 years, the results are evident. It's a long process that including the community participation through the social organization, the leaders, that are a key for the implementation and for the social change.
Thank you so much. Very insightful indeed. Thank you.
Thank you, Dr. Dan and Dr. Milena. We have one question from Dr. Jacqueline from CGIAR LAC as well, Latin American and the Caribbean Hub. For Dr. Gilligan, thanks for sharing impactful examples of innovation. How sweet potato was selected, and if there are other vitamin A rich crops. She's also asking if it is easy to grow, because it's important that the taste is important to attract children. So, Dr. Dan?
Yeah, thanks. So Harvest Plus has been supporting, through its biofortification initiative, has been supporting breeding and development of a variety of nutrient-dense crops. Orange sweet potato is just one of them. And I want to emphasize working with local breeding happening in country. But orange sweet potato was an early success in the sense that the breeding was highly effective to create a sweet potato variety that was a very dense source of vitamin A. It's very orange. And through efficacy trials, they showed that eating a sort of even a modest portion of orange sweet potato can really improve vitamin A status through blood samples, measured through blood samples. So it was, as I mentioned, an early success, so they decided to really promote its expansion. This was also because in many of the African countries where Harvest Plus was targeting, where vitamin A deficiency is a serious public health problem, white and yellow flesh sweet potatoes are popular varieties to grow. So as a sort of secondary crop, or even in Mozambique, it was a primary staple crop. White and yellow sweet potato were very popular. So the idea here for biofortification was to encourage farmers who are growing white and yellow sweet potato to substitute those in their fields for orange sweet potato, at least in some portion, and then bring that into their diets. And if there's a surplus, to sell the surplus as well. And our study, as I mentioned, in Uganda and Mozambique showed that that strategy was highly effective, and it worked just as planned. There was substantial substitution of white and yellow sweet potato for orange. Those households started to grow the orange sweet potato they grew, they started to consume it. They were selling surplus in local markets. It became very effective. And as I showed in the slide, we saw a deep reduction in the prevalence of inadequate vitamin A intakes. We also had serum retinol measures in blood samples and found some impact there as well. So it was really a great success story, and one that they've since kind of expanded to a variety of countries. Thanks.
Thanks, Dr. Dan. Just one, before I go to Beatrice, just one question from Dr. Jackie as well, for this time for Dr. Milena. She's asking if Sumapas experience has been replicated in the neighboring towns, but she also commented that the Sumapas experience is impressive. Dr. Milena?
Okay, thank you. Yes, the experience has been replicated in other 3 rural areas in the same city, in the Bogota. This city is a particular case because it's the capital from Colombia. It's a very big city, but it has within a very big rural area. The most important is Sumapas, no? But there are other mixed areas with rural and urban areas. So the model has begun to replicate in other 3 areas, and the idea was that it became a model of city to abroad the health in rural areas.
Thank you, Dr. Milena. For the interest of time, I can only accommodate one more question, and Dr. Beatrice, you have now the virtual floor. And for all the other questions that you may have, kindly put them on the chat, and we'll email the speakers if you have them for them to answer your question. Dr. Beatrice, sorry.
Thank you, Art. Thank you for this excellent presentation, and yes, indeed, very inspiring. Very quick question to Dan. You mentioned in the presentation, and I know your work is now very much leaning towards equity as well. And I wanted to kind of know, how do you think you would engage with social innovators? What's the type of work, and how would you identify them? Are there any any ways that it can be a collaboration with SIHI, and as well, but maybe it'll be for a follow-up discussion at one point, is it's interesting to see 50 years of the research, the CGIAR research networks, and you must have so many lessons learned that you could share with us and we could benefit from, but obviously the time will be short, so maybe one idea out of your mind. Thank you. Over.
Okay, thanks, Beatrice. Yeah, so I want to emphasize that a lot of the approaches that we use, whether it's in social protection or nutrition or other areas, really rely on coordination with local partners. And often these are implementing partners. They could be local NGOs, it could be local government or national government. And that's sort of our leading strategy. So, but I know that SIHI also focuses on community-driven processes and trying to identify innovations that are coming out of communities. So that's in keeping with our model. So we're really involved in strategies that link, like within Her Plus, for example, we have a focus on socio-technical innovations, be it in agriculture or gender. And so those are ones where it's not just the technology, for example, like orange sweet potato, but the methodology for informing women about the benefits of this crop and the benefits of feeding it to children. So we tend to work on highly complex, multi-sectoral interventions. One of our focuses is then on doing very carefully designed research studies to show, like RCTs, to show the impact of those. So that's something that we've done successfully in sort of all of the hub countries that were mentioned here for SIHI. And so, I'd be eager really for a follow-up on this, and could connect any of the SIHI members to other, to specific researchers on specific topics. I will, so you've asked to share kind of, one success story. We had a process of sort of gathering innovations as we went through this reform. The one that I'll focus on was actually mentioned by Maria Teresa, and this is one of combining the research that we provided across several countries was looking at the effect of cash transfers together with nutrition behavior change. And we've had research on that in Ecuador, in Mali, Bangladesh, Ethiopia, Uganda. And just two key findings there is that the combination, when again, multi-sectoral approaches, in this case, a cash plus approach, led to really broader results than we would have seen either from just cash transfers alone or nutrition behavior change alone. In Bangladesh, the combination of cash and nutrition behavior change reduced child stunting prevalence by nearly 8 percentage points. It's a huge effect, and through the Transfer Modality Research Initiative there in Bangladesh, my colleagues identified this really large effect on stunting when you both relax the budget constraint with cash transfers and provide the information through nutrition BCC. The other interesting thing coming out of that is that there were also complementary effects in raising women's empowerment through this combined program, and that actually showed up as a reduction in intimate partner violence. And we have that evidence from Ecuador, Mali, and Bangladesh, and we're working on similar evidence elsewhere. So this integrated model of working with households to provide income and also information has had a really broad set of impacts. And I think it's a good example of kind of what we might do together with SIHI. Thanks.
Thanks, Dr. Dan. So I think that's our last question. Before proceeding to our closing remarks from Dr. Meredith, I would just like to encourage our country hubs that if you want to feature a speaker, an organization, your partner organization, just email us at the Secretariat and we can organize the SIHI Talks for you. Again, this is an opportunity and this is a platform that we're trying to organize to build partnership, expand our horizons here, to better expand our footprint, to really achieve our dream of transforming the world through social innovation. All right, so without at this juncture, I would just like to call on Dr. Meredith Labarda for our closing remarks.
Thank you, Art. I'll be very quick. This has been a very fruitful and interesting discussion. We wish we had more time, but I think if I'm able to summarize what we have so far in 3 points, I think we all see innovation to drive systemic changes towards equitable nutrition or health. We also see holistic and intersectoral view on health and food security. And I think the network and Dan's network also rely on science and evidence-based approaches and use this for systems transformation in the long run. And this would be interesting to partners. So I think Beatrice already started to ask that question. We at the Secretariat would be very happy to connect each of the hubs to would be partners. And so in behalf of the Global Network in SIHI, we would like to thank Dr. Danielle and Dr. Milena for indulging us tonight. And we would like to invite everyone in the next SIHI Talks in September. That would be on September 29. At the same time as this, we will be featuring another group called Valcare. So we hope to see you then, and thank you for staying on. There is just a special request before we go. Can we have a group photo for the initial run of the SIHI Talks? So if you can please turn on your camera, Joreb or Jean can take the photo. And thank you all for staying.
Kindly open your cameras if you're able. Thank you. Should I count 1, 2, 3? Or 1, 2, 3, smile. Okay, I think we have 2 panels, so one more. 1, 2, 3, smile. All right, that officially ends our SIHI Talk. See you again in the next run. Have a good day, everyone. Thank you.
Thank you. You too.
Thank you very much. Thank you so
Thanks,
much.
everyone.
Bye.
Thank you. Bye.
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 Bye.